Give me a second, sir. Okay, so the session will start in 5, 4, 3, 2, 1.
Hello everyone. As we all know that January is a cervical cancer awareness month, and involve 1 out of 9 women every minute dies out of cervical cancer. So let's discuss everything about cervical cancer. So I, Dr. Ankita Bansal, gynecology consultant at Sankalp Hospital, Ambikapur, will be discussing with Dr. Vijay Karan, who is a consultant oncologist working at Apollo Hospital, Hyderabad. So please tell something about yourself.
Hi, Dr. Ankita. Thank you for joining us in this live session. It is always very good to have a gynecological perspective when it comes to cervical cancer, because you are the ones who first identify the cancer and, then our role comes in. I'm a consultant oncologist working at Apollo Cancer Hospital in Hyderabad. I have about 7 years of experience. I did my MD from Cancer Institute in Adyar. Post that, I've joined Apollo and I've been there since.
Oh, okay, that's great, sir. Thank you for having me in this session, and I'm so grateful that you are here with me. So let's start. Cervical cancer is a very common cancer in the developing countries. ये बहुत it's continuously increasing. ये हमारे जो इंडिया it's a developing country, so इनका नंबर लगातार cervical cancer increase होते जा रहे हैं. There are so many risk factors. पहली बात, सर्वाइकल कैंसर होता क्यों है और किनको होता है? सर्वाइकल कैंसर जो होता है ये बच्चेदानी के मुंह का कैंसर, जिसे हम आम भाषा में कहते हैं बच्चेदानी के मुंह, उसका कैंसर होता है. अब ये किन किन महिलाओं में ज्यादा पाया जाता है? ये यूजुअली उन महिलाओं में ज्यादा कॉमन होता है जैसे जो जिनके बहुत सारे किड्स होते हैं, and who had multiple deliveries and who are usually practicing poor social hygiene because they are not aware of the importance of the social hygiene, and who become sexually active at an early stage. So these are the risk factors that cervical cancer can happen to this woman. अब आता है कि सर्वाइकल कैंसर के क्या क्या सिम्टम्स होते हैं, हाउ वी कैन रिकॉग्नाइज इट, कैसे हम जान सकते हैं कि सर्वाइकल कैंसर के क्या क्या सिम्टम्स होते हैं और कैसे ये प्रेजेंट करता है. तो जिन जिन महिलाओं को सफेद पानी जा रहा है बहुत ज्यादा, लंबे टाइम से कमर में दर्द है, पीरियड्स के दौरान हैवी ब्लीडिंग होती है, या 2 पीरियड्स के बीच में हैवी ब्लीडिंग होती है, या उन्हें कॉन्टैक्ट ब्लीडिंग होती है, आपसी संबंध के बाद अगर ब्लीडिंग हो रही है, तो आपको सर्वाइकल कैंसर हो सकते हैं. ये सब उनके लक्षण होते हैं. अब आता है हम कैसे जानते हैं कि आपको सर्वाइकल कैंसर है. जब भी आपको कोई ये सिम्टम्स हो तो आप अपने गायनेकोलॉजिस्ट के पास जाते हैं, तो वो या तो एक आपको पर वजाइनल एग्जामिनेशन बोलते हैं, जिससे आपके सर्विक्स को टच करके बता सकते हैं कि आपका सर्विक्स कैसा है, कुछ उसमें कैंसर होने के चेंजेस हैं या नहीं. या हम एक पैप स्मीयर और एलबीसी कहते हैं, जिससे हम स्मॉल अमाउंट ऑफ टिश्यू या फ्लूइड लेते हैं आपके बच्चेदानी के मुंह से, फ्रॉम नेक ऑफ द वूम, एंड उसको फिर हम टेस्ट के लिए भेजते हैं. अगर आपको कैंसर, ये एक ऐसा कैंसर है जो हम 7 साल पहले प्रिडिक्ट कर सकते हैं, 7-8 साल पहले, अगर हम रेगुलर सर्वाइकल स्क्रीनिंग कराएं. सो ये हम उस एलबीसी और पैप ले सकते हैं, या तो हम छोटा सा टुकड़ा ले सकते हैं बच्चेदानी के मुंह से. ये पहचानने के तरीके होते हैं. अब जब हमें पता चल जाता है कि अब हमें सर्वाइकल कैंसर है, तो इसके कुछ ट्रीटमेंट ऑप्शंस होते हैं, जैसे कि सर्जरी, रेडियोथेरेपी और कीमोथेरेपी. ये हमें डॉक्टर विजय डिटेल में बताएंगे. So this is all about a brief introduction regarding the cervical cancer.
Thank you for such a informative yet short description of cervical cancer. So that is very, very important. Like Dr. Ankita had said, cervical cancer numbers are increasing. It is the 4th common cancer right now. Actually, in past 5-10 years, if you look, it was in the top 2 to 3. Slowly, because of awareness and more awareness among people about taking vaccination, the incidence has come down. Now it's 4th, but still it is still one of the most common cancers. It is also one of the most preventable and most treatable cancers as well. Like Dr. Ankita has mentioned, you can detect it at a very early stage, one of those cancers which can be screened regularly, and it has the most effective screening. So getting a pap smear done once every 2 to 3 years is very, very helpful. Most preventable, again, because it is one of the only few cancers which has a vaccination against them. Even if it does slip off your hands and it does come to cancerous stage, from the precancerous stage to cancerous stage, it is still very, very highly curable. Even if it is a stage 3, stage 4, 50 to 60% of the patients are still in a stage that, it can be cured. Coming to risk factors, Dr. Ankita will elaborate more. One of the main risk factors from an oncologist perspective, I would say, is HPV infection, because HPV infection, especially in Indian women, goes undetected. People don't realize that they have an infection. It is fought at the first stage, initial stages by the body. When you get repeated infections, like Madam said, 7 years, so 7 to 10 years is actually the time when the first HPV infection happens, and it can actually become cancerous. So you have a lot of time where you can actually detect it and get rid of it at an early stage. When you come to symptoms, I would say in my practice, the most common symptoms is white discharge and any abnormal bleeding, whether it is before periods, after periods, in between periods, post-coital, after, sexual relationship with your husband, you have bleeding happening, postmenopausal bleeding again is something that we very commonly see in cervical cancer in elderly women. Common age is around 40 to 50, but all the books, according to the research, they say any woman 30 years and above is at a risk of getting cervical cancer. So moving on from here, we will talk a little more about the prevention and then the treatment. Prevention will be explained in detail by Dr. Ankita, because that's her expertise, that's her domain. She sees patients day in and day out as a gynecologist. So, Madam, coming to a few questions, I thought I'll ask you a few questions from my side, if you don't mind.
Yeah, sir, please, it will be my pleasure, sir.
So some of the questions that, when we do these cancer awareness programs, some of the questions that, the audience asks. So first, one of the first questions is, how do I know like we were talking about screening, right? So how do I know that I get cervical cancer? How do I know that I'm a risk of getting cervical cancer? So if you can elaborate on that, what are the screening processes and what are the risk factors?
Okay, so sir, there are so many risk factors. Like in India, when still there are so many places where the early marriage is a custom, and the people, they don't know about the safe perineal hygiene, so they can get this HPV infection very early, sir. So once they feel that they have this vaginal discharge, having vaginal discharge and the bleeding, and they have, multiple kids. So every woman after 30 years of age should visit their gynecologist for the screening of the cervical cancer, because the screening is the best preventive measures for cervical cancer. And I guess that is the only preventive measures, because by screening only we will realize that she is at a high risk of cervical cancer. Because some of the women, they will not have any risk factor, but still they can have the cervical cancer. So I suggest all women should get themselves screened. So what are the screening tests, sir? What we usually do is, the most commonly, like in a low paying area in the developing country, I'm working in a small city. So where do you work? So the best thing is that just visit your gynecologist. She'll just do a per speculum examination and take a pap smear. That's the easiest way to screen you for cervical cancer. In some of the hospitals where the facility for the liquid based cytology is there, then we can do that also. In दोनों में ही हम, this is just a minor procedure. We will just take with the help of a brush, we will take small amount of fluid from your cervix, and then we will send it for analysis, and then we will get the results. हर 3 साल में इसको करवाना जरूरी है, क्योंकि अगर मान लो हमने एक टेस्ट में शायद इसको मिस कर दिया, तो हो सकता है अपन नेक्स्ट टेस्ट में पकड़ पाए. बिकॉज ये ऐसे सर ने बताया, बिकॉज इट टेक्स 7 to 10 years फॉर दिस इन्फेक्शन टू प्रोसीड इनटू द कैंसर. तो कभी ना कभी तो ये उस टेस्ट में आएगा, या ये कैंसर जैसे जैसे प्रोसीड हो रहा है तब पकड़ में आ जाएगा. सो दीज आर द 2 मोस्ट कॉमन थिंग्स. सम ऑफ द एरिया, सम ऑफ द पर्सन यूज विया, that is visual inspection by acetic acid or visual inspection by Lugol's iodine. They use some iodine or the freshly prepared acetic acid, and उसको हम cervix में apply करते हैं, then we can appreciate the changes. जो आपके abnormal cells हैं वो हमें अलग से दिख जाएंगे. Then we can take a small piece from that and we can analyze them. So this is how we screen in smaller areas for the cervical cancer. And there is another thing, if screening, जैसे कि जो अपनी PAP, LBC या via Willi में आते हैं कोई changes, then we do colposcopy. Now, what is colposcopy? In colposcopy, basically we visualize your cervix through a camera, who will magnify the cervix, and उसमें बहुत जो minor cells होते हैं, then we will able to appreciate it, and we use some filters and iodine to specifically enhance the areas. So there is a high chance that we will not miss anything on colposcopy, and then we take a biopsy. जिससे हम स्मॉल पीसेस लेते हैं सर्विक्स से, अगर कोई लीजन दिखता है, supposedly if you are not finding any lesion but we are suspecting a cancer on a screening test, then we will take a random biopsy from the four part of the cervix, from the four quadrant of the cervix, and then we can analyze accordingly. This is how we screen, sir. These were the screening methods for cervical cancer.
So are any of these, just for our audience to know, are any of these procedures harmful or painful, or do they need admission? They, like you said, they're the simplest procedures, right? So what can a patient expect from it?
Yeah, so basically this all procedures are, there's no harm in any of this procedure, and you don't require any admission. This is just an OPD procedure. You will just have to visit to us. We will make you comfortable, and then we'll ask you to lie down in your supine position, and then we'll ask you to fold your legs, and gently we'll put a speculum inside your vagina, and then we'll take the sample. You can feel little discomfort, that's it. No more pain other than discomfort. Some of the women can have a bleeding after, small amount of bleeding after the procedure, but that's all okay. That will, like, subside within a day or two.
Okay. So as a gynecologist in your practice, you do pap smear for every patient, every woman that walks in, basically.
Yeah, in our hospital, we regularly do.
Yeah. So that is very important. So even if your gynecologist missed that test when you go for an examination or a regular general checkup, you please be sure, everybody should be sure to ask for a pap smear test at least.
Yes, yes.
And like you said, ma'am, it is once done every 3 years.
3 years.
Yeah. So that one thing is definitely a problem for us. See, when we do these awareness programs and we do outreach programs, when you go to these small villages and do screening, and we get a pap smear negative, some of the pap smears do come positive in the sense some precancerous, lesions, changes are seen. But we ask the patient to come back, and they usually don't come back. We tell them to come back after 3 years. So even for people who have access, once you tell them that it is negative, उसके बाद तो उन लोग भूल ही जाते हैं, मेरा negative आ गया, फिर वापस जाने का नहीं है. So that is very, very important. Like we've mentioned twice till now, 7 to 10 years is the time. So at least 2 to 3 pap smears taken every 3 years have to be negative for us to be sure that you will not get cancer.
That's true.
So the next preventive measure, ma'am, anything that you would like to elaborate on the vaccination?
Yes, sir. I will like to add one thing, that there is one more screening method. We usually don't do it because of cost issues. Because we can do high risk HPV testing, that is 16-18. If these viruses are there in your blood or the reflex pap smear, then it's a high detection rate. But because of the cost issues, usually we are not doing it regularly, sir.
Correct.
So this is also one of the method. So if you want to prevent the cervical cancer, then we can practice safe sex practices, perineal hygiene, and we can avoid getting sexually active at an early stage. This is how we can try to prevent cervical cancer. As I said, the best way to prevent cervical cancer is the screening. So yeah, we have another method, that is a HPV vaccination. That will help in the infection of the HPV viruses. We have 2 vaccines available worldwide, although the third vaccine, nanovalent, is also there. The first one is the Gardasil, Cervarix, and the another one is the Gardasil. Cervarix provide a protection against 2 strains that are 16 to 18 high risk, and Gardasil 6, 11, 16, 18, sir.
Okay.
So basically, Cervarix is specific for the high risk, and Gardasil for the low risk viruses as well, which are responsible for your warts and everything. So ये दो vaccinations we suggest after 8 to 10 years की जो भी girls होती हैं उनको ये लगवाना चाहिए. Ideally it should be given before 15 years of age. But ये हम तब तक दे सकते हैं जब तक female sexually active नहीं होती है, because at the sexual contact only there is a high chance that they may be HPV infected. And so, but in our India it is practiced, then we can extend it till 30 to 35 years of age as well. Or we have 3 doses of this vaccinations. The Cervarix should be given 0, 2, 6, and the Gardasil 0, 3, 6, sir.
That's correct. So, like you said, Cervarix is against the high risk HPV, right? HPV 16 and HPV 18. So from an oncologist perspective, 16 and 18, like Madam said, they are high risk for developing to cervical cancer. But 90% of cervical cancer patients that we see do have 16 and 18. So, cost-wise, it is comparatively cheaper to a quadrivalent, but getting at least a cervix vaccination is good enough to, try to prevent cervical cancer. So like Madam said, there's quadrivalent. So 16, 18 is primarily responsible for cervical cancer. The other two variants, 6 and 11. So HPV, apart from cervical cancer, can also cause cancers of the throat and cancer of the anus. So when you take a quadrivalent vaccine that includes HPV 6 and 11, you're also protected against these other types of cancers that can happen with HPV. So just for information, right now, the new WHO guideline has suggested that even if it is one single dose, it is actually efficient enough. So we were thinking of 2 doses and 3 doses. Elderly people, we give 3 doses usually. But right now they're saying if it is a young woman, 9 to 15, 1 or 2 doses is good enough. For women 18 and above, 2 or 3 doses. So that again, it makes it so much easier for, our patients in terms of cost. And again, another good news is that now Serum Institute in India is making cervical cancer vaccine. So from about 3,000, 4,000 rupees vaccine, which usually used to cost around 4,000 rupees, now it will cost around 400 to 500 rupees. So that will again, increase the chances of accessibility and affordability for, especially in a country like India, where cost is a very big issue.
Okay. So I would like to add one more line. As we said that the HPV vaccination helps you in prevention of cervical cancer, but that doesn't omit your screening thing.
Correct.
Even
Very
if you are
important
vaccinated, you have to go for screening. It's not that
Yes,
we
yes.
receive the vaccination, so we will not require screening. No, you
Yes.
have to go for regular screening method.
With the pap smear, yes.
Pap smear.
So that's a very important point. See, now, especially after COVID, there are so many different vaccines that have come. And every vaccine, they say it's different efficacy. Some has 70%, some has 80%, some has 90%. So any vaccine will never be 100%.
Effective.
Right? So like you mentioned, it's a very, very important point, Dr. Ankita, that even though you get a vaccine, even if you get it at a younger age, you have to make sure that you go for screening once you're 30 and above. One of the main reasons why the cervical cancer incidence is high in India and lower in Western countries is this, because in Western countries, HPV vaccination is a part of their childhood vaccination program, like how we get, for tuberculosis and everything, malaria, tuberculosis and everything. For Western countries, it is there in their program. That is why, it is the incidence is much, much lower. Hopefully, now that we are manufacturing in India, the government will actually take it up and add it as a norm within the first 10 years. If you can vaccinate all boys and girls, it will be very, very helpful.
Yeah, we are waiting till it will get included in our universal immunization schedule, sir.
Correct. Yeah. So another question, Ankita. So many, especially because it's an Instagram and Facebook live session, we have a lot of our young people watching this. So some of them have a question saying, if for their mother, if their mother is 40 years, 45 years, 50 years, can they still take HPV vaccination? In your practice, would you still suggest HPV vaccination, or would you give more importance to screening and pap smear?
Yeah. So usually after 40, we don't prefer for this vaccination. We usually prefer screening methods. That's it, sir, because they might be infected with HPV, so it will not be that effective. Till 35 to 40, it can be of certain efficacy.
Correct. So 40 years and above, especially, we prefer not to do vaccination because, like you said, it most probably that they might already been infected by the HPV vaccine.
Yes.
So anything else you want to add, Dr. Ankita, about the preventive measures?
No, thank you so much, sir. You explain everything so nicely. I don't have much to say. So I would like to ask a few questions, sir, for our knowledge. So once the patient is diagnosed with a cervical cancer, we gynecologists take our side that, okay, we have to refer the patient to an oncologist. The moment we see that the patient is inoperable and we don't have to do anything, then we refer the patient to an oncologist. So what is your advice, sir? What should we do once we diagnose a cervical cancer case, sir?
So see, in cervical cancer, like any other cancer, there are stages, right? So actually the stage 1 cervical cancer can be treated by you itself, like by a gynecologist, because you do procedures like cryotherapy or, that loop excision, which 1A cancers which are not visible to the eye, but your pap smear or your colposcopy biopsy will suggest that there are some cancerous changes. At that stage, it is usually can be treated by a gynecologist itself. Because you work in a city in Chattisgarh. So in case suddenly you decide that you found in the biopsy that it is cervical cancer, you don't need to rush the patient to an oncologist. If it is not visible, not obviously visible growth is there, it is only stage 1A, we call it stage 1A, you can treat it by yourself and keep it under a follow-up. Once it comes to 1B and 2A, 2A is usually when we see the patient when an obvious growth is seen on the cervix. So coming from stage 2 to stage 4, I will explain the stages also, so it will be easy for everybody to understand. So stage 1 and stage 2 is limited to the cervix. In stage 2, on the cervix, there's some organ called the sides of the cervix, which are called fornices. So cervix and fornices include stage 2. The next part of the cervix, next to the cervix, is the parametrium. So from the cervix, it goes to the parametrium. We call it stage 2B. Within the parametrium, again, if it goes to the later extent, to the largest extent and reaches up to the pelvic wall, then you call it stage 3B, which is a little locally advanced stage. Moving on to the next is stage 4. Stage 4, again, there are two criteria. One is stage 4 when it spreads only to the adjacent organs. Like cervix के आजू-बाजू bladder रहता है और rectum anal canal रहता है. So if it spreads to these organs, then it is stage 4A. The cure rates are less when this happens. It's only about 40%, but still it is in a curable stage. But when it goes to the next step of stage 4, that it spreads to the other organs, that is the liver, lung, or anywhere in the abdomen, in that stage, we cannot cure the patient. Whatever treatment we give is only to control the disease. So from stage 1, 1A, 1B, and up to 2A, a gynecologist or a surgeon can deal with it. You just do a surgery or excision of the area which is abnormal, and that's about it will be the treatment. Once it comes beyond stage 2A, 2B, that is, it is apart from the cervix, it's come to the fornices, and then it's going up to the parametrium, then my job comes in. So what happens, a lot of the gynecologists, they're not clear about this transition. So when it is stage 2 and they can see it in the cervix, what they do is, elderly female, they just operate. There's nothing wrong in operating, but the only thing is, even if you operate and remove and the patient is stage 2, they will require again radiation and chemotherapy. So instead of going through two different modalities of treatment, you do only one, that is radiation.
Okay.
So from stage 2 onwards, the main treatment, the curative treatment is radiation. Again, when we talk about radiation, it is not nuclear radiation. A lot of people get scared that if I'm getting radiation, I need to be admitted. I can't be with my family members because radiation might spread. So in some way, radiation is actually a misnomer. So radiation that we use for treating cancer is only X-rays. So the procedure also of radiation treatment will be like taking an X-ray. You're just in a dark room. There'll be a machine which stands in front of you. It goes around you and just a light falls on you. So you'll not even feel that there's any treatment going on. So from stage 2, stage 3, and stage 4, we do radiation. Chemotherapy has come as an added treatment along with radiation in the last 10-15 years. So what chemotherapy does is it only increases the effect of radiation. So if I'm treating a cervical cancer patient of stage 2B, the chance of cure rate is about 85 to 90% with only radiation. In case I'm adding chemotherapy to it, then the chance of cure is increased by another 5%. So the main treatment is radiation. We are only adding chemotherapy to add to the effect of radiation on the treatment. So I also try to tell a lot of the audience when we do these cancer awareness programs. So when you do screening and prevention, that is HPV, apart from preventing the disease, you are on a regular follow-up with your doctor because you know what is happening. And even if it does come to cancer, you're sure to catch it at an early stage. So like I was telling you, when you catch it at an early stage, not only that your treatment cost is less, your treatment cure chance is the highest, but you also get to undergo a simpler treatment. That is a surgery that is done by a gynecologist itself near your house itself. You don't have to go through the entire process of radiation chemotherapy for 2 months and spend that entire money. So that is, apart from actually preventing the disease, this is one very big factor that you need to keep in mind. So catch it early, get away with simple treatment, so you will not have any problems in terms of cost and post-treatment also.
So, sir, see, when we are referring the patient to an oncologist for the radiotherapy, we say them that your stage is not treatable, not operable at the moment.
Right.
We're not able
Right.
to operate, and we have to refer you to an oncologist. The most common thing they ask, will there be any side effect, and what is the prognosis?
Correct.
Like today only, I saw a patient. She was 34 years, and she
Mhm.
had cervical cancer. So her husband was asking, "Ma'am, will she be able to survive? And what will be the side effects of the radiation?" So, sir, please let us know, sir.
Yeah. So I'll try to keep it simple. So survival rate, what we talk in cancer, is usually over a period of 5 years. So because we don't expect that beyond 5 years, the cancer can come back, even though possibility is very less, all our studies are based on 5 years. So when we say survival rate, we mean that this is our percentage of patients which can be cured. So when we go from stage 1, so stage 1A, where like you said, we can do a very simple procedure in a gynecology OP itself, like a loop excision or cryotherapy or whatever, that has more than 95% chance of cure. Okay, so that means if you take 10 people of that stage, more than 9, that almost all will be definitely cured. When you come to stage 2, then you come a little down. So 9 out of 10 will be completely cured. When you come to stage 3, 7 to 8 out of the people of stage 3 will be completely cured. When you come to stage 4, again it falls below 50%. So only 5 out of 10 will have a complete chance of cure and having a normal life after cancer.
Okay.
When you come to side effects, so whatever the survival rate is, the end treatment is the same, that you have to undergo radiation for a period of 5 weeks that we call external beam therapy, which I was explaining to you, that you just stand lie down in a room and the machine goes around you. That is external. So externally, the X-rays are coming into your body. Apart from this 5 weeks of external beam radiation, we also add brachytherapy. Brachytherapy is basically radiation, but internal radiation, where the radiation is in direct touch, direct contact with the organ itself. So what we do is, this is actually a procedure done under admission, half a day procedure, short general anesthesia. We take in the patient, depending on where the tumor was initially, we insert something called a needle. It is needle in the sense, it might sound scary, but it is called an applicator. It is a rounded, long, this applicator that we use, which is very soft. This is inserted into the cervix, and then depending on wherever the tumor was, this applicator is connected to a radiation machine, and that machine delivers the radiation directly to the cervix through this applicator. So this is done once a week, and this is done for 2 or 3 times post the 5 weeks of radiation. So the entire process would take about 55 to 60 days. So that's about 8 to 9 weeks is what the usual treatment time of radiation is.
Okay.
So because for brachytherapy, there are no side effects, because you're giving it directly within the cervix in the tumor area, you're not harming anything around it. But when it comes to external beam radiotherapy, because the radiation is coming from outside the body, by the time the radiation actually reaches the cervix area and the area that we want to treat, some of the low dose radiation is also affecting the organs around. So when we are treating cervical cancer, we treat the entire pelvis. So in your pelvis, you have your intestines, your bladder, and your rectum, right? So some of the radiation, when it falls on these organs, the side effects are based on that only. So because it falls on the bowel, that is your intestine, loose motions is a possibility. Second, because it falls on your bladder, irritation during urination or your frequency of urination increasing is common. Because it falls on the rectum, again, there's some burning during defecation or chance of loose motions or constipation can happen. But all these side effects, now, if you look at a cervical cancer patient being treated 20 years back to somebody who's being treated now, there is a drastic change. 20 years back, all the patients used to have these loose motion problems. Right now, we see maybe 1 or 2 patients who are actually undergoing these side effects. Because we do have the technology, we make sure all the technology is directed towards reducing side effects. So we target as much of the radiation to the organ and as much as less to the other organs. Even if they do have side effects, they are very, very minimal. It is easily controlled by taking tablets and medication. Moving on to side effects of chemotherapy. as soon as I say chemotherapy, the first picture that comes in everybody's mind is in the movies when the actor is bald with a cap on their head. So this chemotherapy is not like that. Cervical cancer chemotherapy is not like that. That happens for breast cancer and other types of chemotherapy. Cervical cancer chemotherapy is given once a week. It is given, chemotherapy is an IV drug. So you just go to the hospital in the morning. It takes about 5 to 6 hours. You're connected by an IV line. Glucose bottle will be there. About 5 to 6 bottles will change over a period of time. So this is given half a day. Like I said, biologically, its effect is to increase the effect of radiation. But unlike radiation, where you're giving in a particular area, chemotherapy, because you're giving it in your veins, it goes everywhere in your body. Because of that, you might have some side effects. The possible side effects are nausea and vomiting. So as soon as the injection is given, for the first 2 to 3 days, the patient will lose their taste. They will not feel like eating. Even if they feel like throwing up. This is the most common side effect that we see. Apart from this, there is a possibility that the blood counts might fall. But on radiation, on chemotherapy, when the patient is on treatment, we do keep a regular check. We do a blood test every week to make sure that the parameters are normal. And if any deficiency is there, we'd give injections, and that is also controlled. So I'm trying to keep it as simple and trying to make it sound as good as possible, because I don't want people to get scared.
Yeah.
But generally, if you look at cancer and its treatment, cervical cancer is one of the simplest thing that anybody can go through as in terms of treatment and side effects. And post treatment also, people have normal lives. We've had patients who are 28, 29 years old, had cervical cancer, got treated, and they have children also after that. So in case you're still in the age where you want to continue to have a family, we do have procedures where we transpose the ovaries to keep them away from radiation, or we freeze the eggs, and post treatment they can have normal children also.
That's great, sir. You all are doing a great job, and thank you for the detailed explanation. So just one more question.
Yeah.
Like cervical cancer usually occurs in the women, we diagnose it when the woman is usually at 50 to 60 years of age. And then the attenders usually say that, ma'am, are you sure that she'll get cured? Should we go for the treatment? And, and will ask her to suffer so many perks of this thing,
treatment, yeah.
drugs of the treatment, or should we let the cancer take its own way and have her peace with her cancer? So what should we advise her? Should they go for the treatment, or should we say no, let her live her life with the cancer? What do you want to?
So if it is in a stage 4 and a situation where from the cervix it has already spread to the abdomen, liver or bones or the lungs or wherever it is, in that stage, I would definitely, the first option would be to let her be. Okay. I would not want to try to do anything, because whatever we do, she has to go, because that chemotherapy that we give for that stage is different. They have to undergo the side effects of chemotherapy. Treatment would be for about 3 to 4 months. And ultimately, we are adding just a few more lives, few months of life for her. For that few more months, she has to go through this, chemotherapy of 4 to 6 months and its side effects. So in that situation, if it is an elderly female and is already stage 4, has spread to other parts, the first option we always give the patient is to leave her alone. Let her be however happy she is right now and continue till however she can. Anything below that, I would suggest you to push the patient to go for treatment, especially because it is cervical cancer, because it's such a highly treatable and highly curable disease. The side effects which I spoke to you about is very, very controllable, and it is only during the period of 4 to 5 months. Beyond that, if you just go through that for a month, you can imagine the kind of normal life that you can have after. So that is more important. So anything other than stage 4, I would suggest that you should push them for treatment.
Okay. Thank you so much, sir. It was a wonderful session with you.
Thank you.
And what will be your key message to our viewers, sir?
So there is actually a hashtag quote for cervical cancer, that hashtag no woman should die of cervical cancer, because it is the most preventable and the most curable. Just follow the preventive measures, screening measures that Dr. Ankita has just mentioned with all of you and explained it to you so much in detail. You have nothing to worry about. All of them are very simple, very accessible. Once you follow these screening methods diligently, there is no scare of cervical cancer at all. We can prevent it completely. even if that 5 to 10% do come to cervical cancer, it is again very highly treatable and highly curable. So as soon as you hear the word cancer, don't take it as a death sentence. Think of Dr. Ankita and think of Dr. Karan.
Yeah, it was a wonderful session, sir. Thank you so much, sir.
Thank you so much for your time, Dr. Ankita. It's very nice meeting you, and thank you for the wonderful session to you too.
Yeah.